Hello, I'm Eve McIntyre. I'm a cognitive behavioural therapist. I hold full accreditation with the BABCP and I'm a member of the Counselling Directory. Cognitive behavioural therapy, or CBT, is a form of psychotherapy that's been shown to be helpful in supporting individuals that have depression and anxiety. My video for today will talk specifically around trichotillomania and explain how CBT can be really effective in supporting you if this is something that you're experiencing difficulties with. So when we talk about trichotillomania, this refers to the uncontrollable urge to pull hair. Typically this can be around sort of the hairs found on the scalp, but it does also refer to sort of other hair found on other parts of the body also. So it's not uncommon for people to also experience this, for example, with their eyebrows and eyelashes. Unfortunately, with trichotillomania, it can lead to a significant impact on the individual that's experiencing it. This may be something you're going through yourself and what's led you to sort of look into some support. Common sort of areas where this can impact can include physically, so with hair pulling it can lead to sort of patches of balding, but it can also have, understandably, a really big impact on how someone might feel sort of emotionally and in terms of their quality of life also. So in terms of when we think about kind of the emotional impact, it's not uncommon that actually someone that has trichotillomania can experience or report feelings of shame, embarrassment, low confidence, low self-esteem, depression or anxiety that run alongside. This in turn can also have a negative impact on quality of life. So you could have noticed, for example, that there's changes in terms of how you're feeling within your professional life, within relationships, or maybe it's stopping you from doing things that you would normally do. It's not fully understood how or why trichotillomania develops. It has been suggested that there's a biological and neurological factors that can contribute to this. Biologically, this refers to chemical balances in the brain and or hormonal balances alongside it. From a neurological side, this refers to the role of positive reinforcement and repetition. So from my experience with working with trichotillomania and also with the literature that's available, is that what we can sort of understand with how this develops is that actually it can happen as a result of feelings of tension or distress that are felt. So the feelings of tension can build up, and then actually the pulling of the hair leads to those feelings of tension reducing. So as a result of this, the hair pulling becomes positively reinforced. I feel tension, I pull my hair, I feel better. And actually, if we're noticing that we feel better as a result of the hair pulling, it's then more likely that we're going to then repeat this action in response to other feelings of distress or tension in the future. And in turn, this becomes a habit. Sticking with this idea around sort of the neurological factors that can contribute to sort of the maintenance and sort of forming of trichotillomania, I also wanted to mention something neurologically that's also linked with the therapy around trichotillomania as well, and that refers to neuroplasticity. This is really important to mention because whilst a habit can form and feel very hard to sort of break out of, neuroplasticity refers to our brain's ability to adapt and change based on the context or environment that's there. And we can observe this through the forming of new habits, alternative habits, learning new skills such as languages. And it's our brain's ability that kind of reminds us that actually all is not lost. And actually that's a really important message if actually this is something that's having a really big impact on you, and also links with how CBT can also be helpful as well. So when we think about sort of CBT, this is actually the most effective treatment for trichotillomania. And the reason why it's so helpful is it rests on this idea that actually the hair pulling has developed as a habit over time, and what we're trying to do with the CBT side of things is adapt or change the responses to that habit, which can in turn reduce the distress and the impact it's having over time. So the technique that we use in CBT for trichotillomania is called habit reversal therapy. There's a number of stages to this, and the sort of earlier stages are more focused at observing and noticing and really slowing down what is going on for you before you might engage in the hair pulling. This offers really helpful insight in terms of those triggers or cues that may be contributing, and the idea would be that actually if we can start to notice those and know what they are, it gives us that kind of insight and understanding with then how to sort of change or adapt or break them. CBT is also really helpful in terms of offering alternative behavioural responses, and also starting to change the thoughts that could be maintaining the hair pulling as well. One important thing just to hold in mind with the CBT is that the techniques and strategies are designed to be helpful in the longer term, aiming to replace the short-term relief techniques around pulling the hair to reduce feelings of tension and in turn reduce the negative impact that this could be having on you. If you're experiencing trichotillomania and would like some support, you can find me on the counselling directory Eve McIntyre, alternatively on my website www.adaptive-cbt-psychotherapy.com.